Thank you, Joanna. So I'm going to talk to you today about the future challenges and opportunities for the biomedical science profession, a profession and a resource that really needs the recognition that it deserves. And we've seen today in the plenary sessions a lot about what we do to communicate and why it's important that we get our message clearly and articulately across. For those of you who work in England, you'll know that the Fit for the Future 10-year plan has been issued by the government. This plan is a seismic shift in the way the NHS works in England, but let's not beat around the bush. Any changes that happen in England will see their way through to other UK nations in the way that we work. So it's really important that we engage in the opportunity in the moment that this report gives us. I'm not going to go into details. I'll come on a little bit later on about what this means for us, and I think Simon will be speaking later about the greater detail about that as well. But this is just one more report, one more white paper from government that sets out strategies involving health and involving us as healthcare scientists. So you'll see up there a plethora of reports that have been issued over the last few years. These are the ones that I just knew off the top of my head. There are others out there. And they talk about a lot of things around the way we should deliver health in this country, how we tackle life sciences in this country, and how we should view the world in the way that technology and life science and our workforce can move things forward. We also had 2 years ago the long-term workforce plan. And one thing that we noted at the last Congress was, of course, that we were missing from that. And the theme is, if I go back one slide, we're also missing from these. Pathology and the workforce are not covered in any particular detail. And that's a really, really big issue because, to coin a phrase, we hold the keys to the kingdom for what the government wants to do. Now, there is going to be a revised workforce plan coming out from the NHS soon, and I've been promised that we will be mentioned in them. So we'll hold our breath on that one, both in terms of its publication, but also whether we're mentioned. So it's really important, I just re-emphasize, that we were not mentioned in what some seismic changes in the way the world works. What the government wants to achieve is actually very, very ambitious, and I think we can all get behind it. The shift to prevention will make us all healthier for longer. And that's really, really important, and there's a multitude of benefits in that, not just in we live healthier for longer, but actually we live affordably for longer in terms of our nation, and we need to be aware of that. Now, the only reports that actually covered us in any detail are the 30-year now journey in the changing the way that we deliver pathology services. And these reports actually, probably relatively uniquely, also led to seismic changes in the way that we all work. So you'll all be aware of the networks programme within England. We know also Wales, Northern Ireland have seen similar programmes, and Scotland has flirted with the principle around networking before as well. And it's really important to understand, actually, well, why was it? Why were these reports seismic? And the difference was that actually these were quite targeted. And they looked at what we did and how we did it. But these were also government-led, of course. Now, the Fit for the Future plan really is asking us to move the way, the dial we do things. What we do, how we see things, how the NHS is used, how it's viewed. There's actually, within the Fit for the Future plan, a real change in the relationship, the contract between the public and the NHS. And that shift is going to take a long time. It's why it's a 10-year plan, of course, but it'll take a long time. But it really does fundamentally change the way we need to work. But it isn't just policy that's needed. It's all well saying what good looks like and what we can do. But we need to understand what that shift is and what is it, the fundamental things to make those shifts work. Now, those of you who come to any of my presentations will see I use these slides a lot, and I will continue to use these slides until we have seen the shift that I think is needed. We live in a very reactive time. We have symptoms, we go and see a doctor who will observe us, we have our interpretation of our diagnostic results, we get our diagnosis, and hopefully we get our treatment. And we sit in this yellow box here. And it's not just us, of course, it's the digital connectivity, it's the secondary care laboratories. And we sit very siloed. And that's a huge obstacle to the way that we need to deliver healthcare in the future. So what is it we need to do? Well, one of the things we do when we start talking about prevention, we need to change our paradigm around diagnostics. Those of you who joined us in the politics and pathology session will know actually there is a massive shift towards prevention. And prevention is screening, it's earlier diagnosis, it's identifying the people who are at risk. And we need to see that shift. The other big shift we need to see is for us. And that's to see us sitting. If you imagine this is primary care community, this is tertiary and secondary care over here, we need to sit right across that continuum. We need to be absolutely embedded in care right across the continuum. And we're not at the moment. And it's really important that we start to think, what are the roles that we might need in the future? What are our jobs? When we talk about seeing high-end automation coming on into laboratories, we're seeing new technology coming in, enabling us to do more and to have more of a hands-off approach in some areas. We need to think, what is it we need to be doing as a profession and how that might work for us all? Workforce is essential to make these changes. And also, we've got to remember that we've got to make this safe for our patients. And that's going to be really, really important. Now, I stole this slide off Sarah May, who not only organises fantastic conferences, but also does fantastic slides to describe us. We are the most flexible workforce within medicine. There's no two ways about it. All of you will be involved in such a wider range of pathways, and your knowledge base and your skills really enable you to do a lot of things. And we as a workforce, our basic in terms of our qualifications, mean that we can be those stem cells, and that we can move into new arenas, we can take on new skills, we can take on new competencies, and we can make a difference in the way we do diagnostics. Now, we set this out last time in our long-term plan around workforce, and we were asking government to make sure that we are able to undertake the roles that we can do, to make sure we have enough biomedical scientists coming through the pipeline, and that we are seeing advanced roles are being adopted. And that's not just the advanced clinical specialist roles, the scientists working with equivalents to medics, but it's actually people sitting in different areas as well. And we just start thinking about what are those examples, what are those use cases where we could be sitting in different arenas and providing our expertise into the way things work. The Institute continues to develop its qualifications, making sure that we have roles and responsibilities and competencies that make sense to the health system. And I'm very, very proud of the fact the Institute does not create a qualification that's not needed. It doesn't seek to move into an arena where it is not wanted or welcome, but it does make sure that we have people who do move into those advanced areas have the qualifications and the competencies and the training and education that they do need. So how do we turn policy into action? What is it we're doing to make sure enabling the big shifts that we're seeing set out in the 10-year plan, in our ambitions as a profession, and the way we need to change the way we work? The Institute, over the last couple of years, has been working really hard producing high-quality advisory papers to the system. And I'm very proud, actually, that not only are we developing new papers, but we have members of industry coming to us saying, can we do some work with you? We've identified an issue. So what do we need to do? We think these are the recommendations. And we've produced a whole range of white papers, often based around, drawn out of expert roundtables where we've brought people together. But the names up there are significant. We've got Microsoft, we've got AstraZeneca, we've got Roche, we've got BD, we've got Hologic and others, where we are joining together to build our voice towards government. And every one of these papers is geared up towards the system. It's geared to give a very, very clear voice to commissioners, to policymakers, to government about what we can do as a profession and what we need from government to make that difference. And Joanna mentioned things like the bowel cancer pathway research we did with Voxera, demonstrating to the Treasury is the purpose of this paper, that we bring a considerable value to the NHS. Ignore us at your peril is essentially the thing. As Joanna's speech said, over £150 million every year is enabled in terms of cost reduction in what we're doing. It's not savings. We move that cost from the system by being biomedical scientists. And most recently, the Power of Testing report we've issued alongside Roche is setting out some really clear examples of how we, working in diagnostics, so us biomedical scientists working with industry, can actually make a sizable difference in avoiding ambulance conveyancing. making sure that pregnant women are seen at the right care level for their health, and making sure that actually every opportunity to do the right test at the right time, in the right place, for the right patient is always met. So I'm very proud of what the Institute is doing at the moment to really build that advocacy. And we heard earlier on from Simon, from PLMR, actually how important is it to make sure we're having clear, compelling arguments that we can present in front of ministers and politicians so that they can grasp that. Some of them can take it in from their own personal lives and say, I understand that, I understand why that's important. And we really are seeing dividends in that. The Institute does not work alone. The Institute works with its sister organisations, LabMed and RCPath, producing guidance, producing thought leadership, making sure that we remain relevant. And this is really important. We are not an island. The Institute is not an island in itself. The Institute is powerful, it has a strong voice, and it has the ability to speak up for itself. But actually, we need to speak sometimes as a whole profession, from those working in support grades right up to our medical colleagues. So what do we need to do? We've seen and we heard today the importance of how do we influence government. And we now need to start bringing policy a lot more clearly towards government and making sure that actually your voice through the Institute is clearly heard. Joanna mentioned shortly that on Friday we announced the commissioning of an independent review of pathology transformation in the UK. Now, this is not a report like the old Carter reports. This is a report that's been commissioned by the Institute to support actually understanding where are we, what do we need, what's next. I'll just put up this quote up from Joanna for you to read while I have a quick glass of water. But we need to be able to build that clear picture of where we are. As I said, this report is not like the other Carter reports. This is different. We are asking the questions. We are taking that policy to government. Now, it's important we recognise the fact that efficiency is important, but we need to make sure that we've got quality right. And that's really important. What are the quality frameworks that we're working in? What are the things, as new innovations come in, what are the things that we need to be aware of? When we're seeing diagnostics move to the community, to pharmacy, what are the controls to make sure that we as professionals in terms of diagnostics are protecting our patients with the right test at the right time? And we've heard across the globe, actually, that when testing has been opened up into the community, particularly through community centres, that actually it leads to a burden on the health system with additional testing if it's not done right. And we in the UK need to make sure we don't make the mistake of some of our European partners in the way that we do that. Like I said, this report is going to look at what we're doing and where we are. It's commissioned by us, but it's very much in partnership. We have the Royal College of Pathologists and LabMed supporting us, but we also have the transformation leads from the 4 nations health systems involved and supporting us. And I'm also really, really pleased to say that actually we've also got Jim Mackey, who's the Chief Executive of NHS England currently supporting us, and we have the Permanent Secretary of the Department of Health and Social Care supporting us in this endeavour. And this is the profession taking that conversation to the governments of the 4 nations. So what will this report do? This is very much, and those of you who know when I worked in NHS England, I used to produce a report every year called State of the Nation. And that's what we're going to do. We're going to say, where are we now? What does it look like? What have we got? What works well? What's not working quite so well? What do we need to change? What are the barriers? What are the obstacles for us making some of those changes? How do we, as a profession, enable the 10-year plan and similar health initiatives move forward for our patients? This is really, really important. The other parts of the report around workforce. We all know that the ageing population impacts our workforce. We know there are increasing vacancies and short supply in certain areas in specialties and also parts of the country. And are we making best use of our workforce? Do you work to the top of your license? Are you enabled to make sure that you add the value that you can add as a biomedical scientist to the system? And so we're going to ask those questions. Where are advanced roles being adopted? Do we have evidence to say that they are producing and paying dividends in terms of the way we're working? We know there is a huge shortage in medically qualified pathologists in the UK. It'll take many years, possibly decades, before we can close that gap, even if we started today to fill up medical schools with potential pathologists. So we as a profession have our role to play to make sure that gap does not become a patient-critical issue. We have a responsibility to our patients to make sure we're working at the top of our license in every role that we undertake. And we want to look in that report to say, okay, so what would that look like? What would happen if we managed to close some of those gaps? And also speak clearly for the entire workforce, and to make very clear, we do need pathologists. We do need, we mentioned earlier on about new qualifications in paediatric placental reporting, but we also need the medically qualified paediatric pathologists, of which we are in short supply in this country. So we want to be very, very clear. I'm also very, very proud of actually what we do in the UK. In the UK, we have a highly qualified workforce. We have high-quality services, and no patient in the UK cannot access a test that they require for their onward care. And we want to benchmark that against other international comparators, the States, Germany, France, Australia, and others, to see how do we compare. How does our way of working impact or compare to those international comparators? And we're very fortunate in the UK that we do have advanced roles. We do have people who can work in roles that are very different in other parts of the world. Let's evidence that and celebrate it. And again, going to Joanna's point, we have the position as a world-leading organisation, I would argue, to be able to set a voice that actually the biomedical science professional, clinical scientists and others can actually do a lot more within their roles, and that we can actually make a seismic difference in the way we care for people. But also, as part of the review, understand where are we? Do we have blockers in adopting new technology? Do we have blockers, or are we too slow in bringing in new tests that make a difference? Are there new ways of working, that shift towards prevention? Are there other things we could be doing? And one of the things that as a personal view is, what are we doing to support better access to phlebotomy and for testing for the people who need it? How are we removing inequalities from our health system? We hope that this report will deliver an authoritative report that will be our springboard and for us to guide and influence change. This report is by the profession, for the profession. And this is unique, and actually one of the things that's been mentioned as we've been discussing the commissioning of this report by Lord Carter is, it is very rare for a workforce to come forward and say, let us help you answer the question, government. And it should be seen as actually the way you run these sort of reviews into the way you deliver care. No more should we allow government policy to be done to us, as Simon said, by people who perhaps do not understand the nuances, the capabilities of our workforce, the nuances and the capabilities of our capacity in our laboratories, or the nuances and the challenges we face in terms of budgetary constraints. What are we doing? We can go with those answers. And that's a very, very powerful point that we need to make sure we're making. In commissioning this report, we're being bold, but I'm confident that actually in commissioning this report, we will set a way forward, a route map, a set of recommendations that will support the government in delivering its 10-year plan. And pathology will be seen as a pivotal and critical part in that change. And we as a profession have a powerful voice through this report and through your institute, so we can link policy to those who deliver change. And as I conclude, I'll make one observation. Prevention is not a new policy shift. Prevention has always been there. And we have had a situation where we have delivered care in a reactive state, which actually always stops us being a preventative healthcare system. We all know that actually if people understand their medical history, if they understand their diagnostics, if they understand their disease, they do better. It's not new. And we can be a key part of making sure that actually we are the profession who leads on that shift from disease to prevention, leads on that shift from acute care to home in the community. And as because we are natural adopters of innovation, the shift between analog and digital. And it's my view that actually undertaking this report, we'll be able to link policy to those who deliver change. And that is a significant piece. And if we want to go back a little bit further to where did prevention come from? Prevention started back in the days of Hippocrates, 2,500 years. And we stand on a moment where actually we can turn that 2,500 year policy around medicine should be seen as prevention first to a reality that we can deliver as a community. Thank you.